Welcome back, everybody, to the Little Less Fear podcast. Continuing the month of nutrition, physical therapy, movement, and how it's all so important for us to continue for a long, healthy longevity. I've got today Marcus Davis. He is a physiotherapist. Welcome, Marcus, to my show.
How you doing?
I'm doing pretty good. So hey, I'm questioning this because I don't really know the definition myself, and I'm sure a lot of my listeners don't. But what is a physiotherapist?
Okay, so a physiotherapist is basically like we can't call ourselves physical therapists, right? And there's certain things that we can't do that they do. But to keep it simple, basically it's a way of using different exercises, right? And massages and physical like muscle releases to get a favorable outcome, right? If that is like a muscle that was super tight, not being tight anymore, if there was an imbalance, right? Like, maybe you're using your left leg more on a squat than your right leg, right? There's a way to fix these issues, and a physiotherapist, or at least a good physiotherapist, should be able to figure out how to fix it, right?
So, using that as an example, let's say you have a client or a patient, and you notice that their squats. I mean, how would you know that? How would you know if there's an imbalance, let's say in a squat?
So I mean, it's really a matter of like being able to see certain cues. So, right, a good squat usually entails your heels being in the floor, right? Some people are going to have an arch in their foot, but that's not going to create their heel coming off the ground. So that's one. You can look at their knees, right? If their knees are caving inwards, that's called valgus, and that's bad, right? That's where most of our tears are going to happen. Um, if they're leaning forward when they squat, there's a ton of ways that we can see, right? And also all those different things I just mentioned, right, are different things that I would see, right? Different muscles that I can see are weak or being overpowered by something else.
And how do you figure out which muscles are weak in that case? Like if you just see the person, to me it would be like, man, you're just not balanced anywhere. So like, where do you start?
So I mean, at least for me, I usually start with mobility, right? Like trying to create some kind of standard mobility for the patient or client. But for example, like if someone's squatting and their knees are caving in, that usually means that they have weak glutes, right? And that's like your butt muscles. And you think that we use them all the time, but you'd be surprised that a lot of people are really quad dominant, right? They've learned how to operate without using them, and that causes problems.
Oh wow, that seems really challenging to try to figure out how to balance somebody's body out.
It is, but it also isn't as it. There are people that are harder, but there are certain conditions that create like a surplus of like one type, right? So the fact that like a lot of people work office jobs. I mean, like my full time job, right? I sit in a chair for 7 hours a day,
Yeah,
right?
and that can
Like
start making things unbalanced already.
right. So a lot of the people that we're seeing are going to be people that have like a tilt in their pelvis that's unfavorable to their lower back, right? So
Yeah.
knowing little things like that, right, being able to pick out trends definitely helps. But every once in a while, you will get someone where you're like, "Damn, I don't understand like why you're hurting. I'm gonna figure it out, but like it's not clear cut. It's not like I can just look at you and be like, "Oh, dude, you have an office job, huh?" You know what I mean?
Yeah, it's not like you can get one of those balancers when you're doing construction and like put it on someone and be like, okay, this is
I mean,
this is very.
and that's the thing, right? Physical therapists like can actually lay you down and can feel your hips and be like, "Oh, damn, like you're off." You know what I mean? And that's like the next level. That's like they're doctors at that point, right? They're
Uh-huh.
doctors of physical therapy.
Yeah. So then, with physiotherapy, do you also work with, is this just for people like everyday people or people that also had like operation surgeries and stuff like that? I mean, is it like a broader spectrum, or is it just like
It
for
really is.
sports?
So everyone has asymmetry, right? Like that's just a fact of life. Even professional athletes, like they look great, right? They're buff, like they're huge, but even they have asymmetry. Um, it's for everyone. I guess that's what I'm getting at, right? Like,
Yeah.
you know, even at like the top of the line, right? There's still things you can improve on. And then, for people that like got out of a car accident or have a knee injury or something, right? Like they
Yeah.
still need someone, or they need to have the knowledge to be able to fix it themselves, right?
Right.
So that's really where a physiotherapist or therapist steps in.
And physiotherapy combines massaging as well.
Yeah, there's like a lot of like myofascial release therapy, things like that. Some really good physiotherapists and therapists use scraping, right? So that's literally where they're like scraping the fascia of your muscles, trying to release muscles that are too tight. If you've never tried that, you honestly should. It's painful, but it works really well. Like it's
How do
like
they
instant.
scrape? What are you using to scrape with?
It it looks so it looks kind of like primal, to be honest. Like it looks like a club, like a bone club almost, and they're just scraping it along your body, right?
Wow.
And it does not feel that good. Like in certain areas, right? It really really sucks. But the change after is almost instant. Like I recently had a lower back issue where I was seeing a physical therapist, and my hip was acting up like the second visit, and they scraped it. It hurt. Like I was, wincing in pain. But literally after 5 minutes of them doing that procedure, I was able to move my leg around in places that I wasn't able to do it for like 3 days. So,
So how did that scraping work? What did it do exactly to the muscle or the
so if
tendons
there,
or whatever?
so right, fascia is basically like, if we're gonna keep it simple, right? Think of it as like if there was like dust between your muscles, right? And that dust between your muscles is causing them to like lag, like they're slower, they're uh they're lethargic, right? Like I'm trying to like keep it simple here, right? What the scraping does is it's like cleaning out the overgrown fascia in your muscles to create more, I guess, latency, right?
Hmm.
um so it kind of just allows you to be a lot more loose after.
So it gets
It's
rid of
almost like
like the
if you were to
buildup.
say that again.
It gets rid of like a buildup type thing.
Yeah, it's honestly like, especially like a lot of us, right, that sit at computers, right? We have super tight anterior deltoids because we're like this all day, right? We're
Yeah,
on the computer, shoulders are forward, right? If you're there, you're there for hours, you don't even realize it,
I'm doing
right?
that right now.
You're
I'm
doing
like,
it right now.
yeah.
Right? So um those muscles, right? And getting those scraped would suck. Like I'm just being real. They would suck because they're a small muscle group, and that's like a bone club just going over and over.
Damn. So it
But
feels like a burn.
no, it feels like someone's scraping you, right? But with oil, right? So it's like
Oh,
it
jeez.
hurts, but it's not penetrating your skin
Yeah. And so that helped with your hip issue that you were having?
instantly.
Wow. How is that different from cupping?
So to be honest, I've never been cupped, so I can't attest to like the difference between the two. Um, this like with my own experience.
Mm,
But I assume cupping is kind of the same deal, right? Like you're trying to break up areas that have gotten super tight.
yeah.
So there's multiple ways to, as they say, like right, there's like multiple ways to like skin a fish, but like you still got to eat it.
Sure. So then what got you motivated to become a physiotherapist?
So, man, for me, it was multiple things. Like, so my son was like a big part of it, right? Because like I wanted to help him, but also I used to play rugby in college, and I had a complete ACL blowout, and I got the surgery, I got the therapy after, and that kind of got me interested because it just I got to see it firsthand, and I also was a kines major when it happened, so it was like, oh, like real life experience. You get to be your own patient here,
Yeah.
and I'm basically back to normal. Like I can still jump super high, run pretty quick. Like every once in a while my knee does mess up on me, but I feel like that was kind of like what got me into it is like, oh, okay, like this happens to a lot of people and they need to get fixed. So there is a way to go about it.
Hmm. And how did you, as far as like gaining knowledge while you were a kinesiology major, like how did that help you heal and learn how to heal your body?
So to be completely honest, I feel like I learned so much more. after college, right? Like, you can attest, right?
Yeah.
College is like, hey, these are the things we think you need to know. And then life hits you and it's like, yeah, but this is what you actually need to know,
Right.
right? So I had an internship at UCR where I worked with their D1 strength conditioning program for about 6 months. And in that time, like I kind of got like a rework or a revamping of like how I understood training,
Hmm.
and like what's just like what is important, like get rid of all the fluff stuff that you see on Instagram, like I'm gonna do a battle rope on top of a Swedish ball, you know what I mean, like
Yeah.
that type of stuff, like get rid of all that, like
Right.
what works, like what's important, what is vital for someone to be
Optimal.
physically fit, yeah, and
Yeah.
optimal, right? um so that helped a lot, and then just experience, right? Like you meet
Hmm.
people that are, for example, right, like you meet someone that has like the body type you want and you're like, hey man, what are you doing different than what I'm doing, you know what I
Right.
mean, right? That type of stuff. You see people that have like gone through bad injuries and you see them better and you're like, hey, like what did you do to like get here, you know what I mean?
Yeah. Yeah.
um, being open minded and inquisitive definitely um, helped a lot. And I feel like, especially with this field, right? It's evolving. It's still pretty new. If you're not open minded and you're not, questioning why you believe certain things, you are going to end up becoming like making yourself obsolete.
Yeah. Right. Exactly. Yeah, for
So
sure.
yeah.
And then you also mentioned your son. You wanted to help your son. How did you want to help your son?
I just like I want him to be happy, right? Like if if him if him walking, right, like normal, like like someone that doesn't have any disabilities, right, if that is like what his goal is, like sure, I want to help him get it. If his goal is to just be able to walk with a walker and be content with life, then hell, like I want to help him get that too. Like it doesn't matter like what his like final goal is, but I know that if I have more knowledge, I can help him get there, whatever it is.
Yeah, for our listeners that don't know your son, what type of movement problem does
It's
he
called
have?
a
Or
spastic diplegia or
okay,
diplegia.
and how does being a physiotherapist help you understand his condition?
You just understand what's going on as far as the muscles, right? Like you can see like what the protagonist, antagonist muscles are in his body, like what muscles are overperforming, which ones are underperforming, that type of deal. And for someone with spastic diplegia, right? It usually has to do with high tonicity of the lower extremities. So, your hips, like people don't realize, like your hips, your glutes are crazy important to like just your overall body, like right, like your glutes are like pretty much like the strongest body, like strongest muscle in your body, right?
Hmm.
And if they're not working properly, it kind of throws everything else off. So someone that's dealing with spastic diplegia, right, the hip strength is one of the hardest things to work on, and it's also the most important, right? So it's like you're
Right,
constantly trying to like break through that muscle group.
right, right. Oh wow, that could be really, really challenging too.
Yeah. But the thing is, right? Like, kid is super happy. It's not like he's like mad that he has cerebral palsy.
Right, right.
It's just like it's a fact of life, and he's like, I'm happy. I'm gonna just keep going, and that
That's
that is
excellent.
amazing.
And that's motivating too.
Yeah. Right. Like people are complaining about like regular everyday stuff, and it's like, dude, look over here,
Like,
please.
yeah, exactly. I hear you on that one. So, I mean, what keeps you motivated? What keeps you going with being a physiotherapist and learning more and knowing more and growing more with it? What keeps you motivated?
Seeing results for sure, right? Even small results is like awesome. And like, the crazy thing is like a lot of times when you have clients, and I'm sure when you talk to Chris, right, he'll tell you the same thing. A lot of times you'll have clients and like they accomplish something and you're like way more hyped than they are, just because you realize like what happens like on a physical level. You know what I mean?
Yeah. Can you give
Right.
me an example of a time where you had like a patient or a client and you were stuck somewhere and then you finally saw some type of progress and you were like, "Oh, hell yeah."
So I had this client, we'll say that her name is like Lynn, right? and she got into a super bad car accident to the point where like they had to remove her elbow joint.
Oh my goodness.
So she was not able to like lift her arm up, right? She wasn't
Oh,
able to like, do like a curl with her bicep, right?
wow.
And within like 2 weeks of like really like strict focused motion, right, she went able to do it. And I was pretty hyped, and she was actually pretty hyped too. She was trying to hide it. She was trying to hide that, like, she's like 70, right? So like she's already like towards the like end age group of being able to fix certain things,
Yeah.
right? So yeah, and I was like sick, like 2 weeks ago, like we tried to do this and your like arm flipped over backwards, like, and now you have enough strength to keep it in line. Like that's awesome,
And
like
that's
physically, like,
amazing proof too, to show that even at her age, at 70, like it's never too late to gain mobility again.
yeah, gain mobility and muscle. It's pretty cool. Like, you know, there your body is a machine, like, and until it like completely clunks out, you can still try to keep it relatively going.
Do you ever get stressed out when you can't figure something out with somebody and you've been helping them for a long time and it just seems to just not be moving anywhere?
Uh, I don't know if it's stress, but it's more so just like you're kind of
Desperate?
on yourself, like, bro, like, why can't you figure this out? Like, what, like, you know what I mean? Um, I guess that could be frustration. So yeah, I guess that's true. Like, it there are times where you're just like, it almost makes you doubt yourself. Like, all right, I thought I knew this, you know.
Have you ever been like, I think we've tried everything. I don't really know what to do anymore.
I've had clients where I'm like, hey, I think you probably should get an MRI.
Oh, well, that's a good idea.
Yeah, right. Where it's like this hurts, this hurts, this hurts, and I'm like, okay, like, look, you got to be honest at this point. Like,
Yeah.
do you know what's going on? Because I can only see so much,
Mm-hmm.
right? I had a client where like she got into 2 car accidents within like a month, and we're doing a session, like she's like wincing in pain through like every single exercise, and I'm like, yeah, like, hey, you know I think you should probably take a break for a bit. You know what I mean? And it sucks
Yeah.
to have to say that, but yeah, there will be times when that happens, and that, um, you know, having to defer to like sending someone to get like medical care is happens.
Oh, yeah, totally. So, yeah, I want to know, I guess, how and why is physiotherapy so important?
Uh, Physical, like, longevity is just important, so it kind of goes with
Yes.
that, right?
Yes.
Like, you want to there's like this report that came out, I guess in like the last 10 years, but it basically stated something along the lines of like, if you're over 60 and you can't get up and down off the floor, like your life expectancy is like drastically reduced.
Oh, wow.
And like, it seems so simple, but think about it, right? Like, you see those life alert commercials, right?
Yeah.
Someone falls down, breaks their hip, could be like a sentence for someone, you know what I mean?
Oh, for sure.
um, yeah, it's just physiotherapy, right? As well as like physical fitness, wellness, all those things, like they're all kind of like intertwined. Like, you need all of them to live a good life, or like at least like a long life.
So, how can physiotherapy optimize your life or your physical performance, or either one or
So
both?
that really comes down to, if like, if you want someone to look at you and really be able to break down, like, hey, like, I know you're feeling this, but we can make you even better, right? Like, I know that you like to do things this way, but let's see if we can do this. It's going to be more efficient, right? It's going to be more functional. And, that little bit of back pain that you feel when you're squatting, like, maybe we can get rid of that.
That's awesome. Thanks so much for motivating all of us about physiotherapy. This has been really, really amazing. There's things I didn't know. Thank you so much, Marcus, for sharing all your information. I'm wondering, where do you go from here? Has it been hard with the pandemic? Like, how can you see clients and patients? How have you been doing it?
So I was training a couple people during the pandemic. I would like schools are closed down, so I'd be like, hey, we're gonna bring all my weights to the school parking lot and
Yeah.
we'll just work out there. So to be honest, like the pandemic kind of hit me like hard at first just because, like lost my job. Uh, Baby was due like a week, into
Hmm.
it. But overall, like things are good, man. It took some time, but like I have a job now that like I'm getting paid more than like I've ever gotten paid before, which is
Hmm.
amazing, right? I work from home. I'm able to
Right.
like see my kids all the time. So yeah, life's good.
That's great, Marcus. Thanks so much for your inspiration. Everybody, this is Marcus Davis, physiotherapist. He's motivated me to continue to keep moving and continue my own physiotherapy. I'm definitely looking forward to reaching out with you and getting
Oh
a
yeah,
book
definitely.
started, which would be incredible. Thanks so much for your time, Marcus. Love you, man. We'll talk soon.
Love you too, bro. Thanks, man.